PICU, and this is Darcy, and she's, we're co-chairs on the, I forget what our committee stands for. So I think we call it We Get Stuff Done Committee. And I guess that would be important. So you guys have heard about teamwork or been involved with it. So why are we here? And the question of that is, Lauren Smith approached us from Performance Excellence. I can't even think exactly when it was, but approached us with the idea of piloting the teamwork board. And so the question would be, why did we want that? And we have slides over there. So anyway, what we were trying to do is find a way to solve problems, the things that everybody cares about: quality, safety, patient experience. And what we were really trying to do was try and find a way to engage our nurses, who are the people that see the problems and complain about them and have the solutions for them, and engage them and get them to be involved in problem solving. And what we were up against is a nursing perception of problem while reporting and solving. And the reason we came up with this slide was, you would go to a nurse, you'd have a problem, you say, fill out a MIDAS. They'd look at you like, well, why would I do that? This was their perception: report a problem in MIDAS, send it to a committee or leadership, never to be seen or heard from again. So, the problem that we had was just, we didn't know where things went when we did it, when we filled out a MIDAS. We didn't know how they got solved, or sometimes we never heard anything. So what we were looking for was a way to get our frontline staff, who are the people that see the problems every day, to get a tool for them to identify them, and to get a tool for our frontline staff, who are the people that also see the solutions, to be able to work on developing solutions and implementing those. Quality of care and patient safety. One of the first problems we took on had to do with errors with our critical drips, which are things like pressors, pain medications. And you don't need to try to read this, but if you look at the top, these are a series of orders, and you would see that you get an order for a medication, but part of the information was missing. So then somebody would add some more. Well, then maybe something else was missing. So Darcy took this on, and actually the pharmacy was a big part of this. Kathy and those guys started looking at the information you needed. The three areas we identified: pain control, sedation, that's the pre-printed order you see here, antibiotics, and the others were pressors, so things that affect blood pressure, etc. And what they came up with, along with the doctors, was a pre-printed order set that can have all the variables, all the information that you need. So if you need to use one of these medications, you can pull this order set, and you will get all the information the first time. So patient safety and patient quality. The other big area, and this may look like a really small area, I tend to be a person who thinks, well, if we're keeping them alive, that's really what matters. But parents, you get a dad in a room with a kid that just had surgery, and we're worried about keeping his blood pressure up, and or keeping it down, and all these other things that just keeping them alive. And you walk in the room with this pair of pull-ups on the left to put on his 3-year-old boy. This is going to be a really big. This is a big deal, and this was a problem that we had. Is we did not have any blue pull-ups in the hospital. The hospital didn't carry them. So one of the nurses went to distribution, said, why can't we get this? Everybody said, well, there's no reason. So now we have gender-appropriate pull-ups. Okay, and so if you ever have a dad in there, and moms too, to be fair, but anyway. Something that's not maybe a big deal to us, but it's a big deal to patient experience. So how do we go about modifying the teamwork board to get from what we started with to get it to where it was usable for staff? That was a process that took quite a while, quite a few modifications, and I'm going to let Darcy talk about that part.
So when we began with the problem solving and teamwork board, we didn't have much room in the PICU on the walls to put a poster up. And so we actually kind of took the concept and created our own area. So you see the poster board that we used, and it's just up on the cupboards. And with the increased amount of problems that we were solving and moving on the board, we went to the teamwork board that you guys are all familiar with seeing today. So we went from problem solving to the teamwork board, and this was the initial paperwork that we would start on, and it was really intimidating and very cumbersome to work through. It scared the dickens out of me. And it made people not interested in kind of wanting to go and pose problems. And so we met with Lauren from Performance Excellence, and we created our own Post-it note for problem solving. And from there we have the problem, and then we're actually able to brainstorm ideas with the staff, nurses, physicians, just a multidisciplinary team, and come up with solutions. And this allowed us to implement solutions a lot quicker than what we had been able to do in the past. The other thing to note with it is that if you do have a big problem, sometimes you are going to have to go back to that main problem-solving process and all of the tedious paperwork that kind of went along with it, because it is important in order to map all the little sequences, because what you think is the answer is not always the answer to the problem. So in the first few months, we actually had 18 problems that were posted, and then we had 10 solved. And some of those problems were the pull-ups, critical drips, IV line labeling, IV pump availability, room readiness, norepi kits on the unit. And this is what our teamwork board looks like today. We've had a lot of accomplishments over the last year that it's been posted on the unit. We see a lot of problems, and we've been managing a lot of problems over the last year, and we've actually changed the way that we do things on the unit with our huddles. We went from kind of daily huddles with the night shift and day shift, and now we do weekly huddles. So what we do is we pull a problem from the problem area in the red, and we meet with staff 2 times a week. So on night shift, they'll go over the problem, and with the multidisciplinary team, if the doctors are present on night shift, the respiratory therapists, unit clerks, nursing staff, and they'll brainstorm ideas. And from there, they'll pass it on to day shift. So day shift has the opportunity to go through that same problem and brainstorm ideas. Leadership is also involved in the day shift huddles for the problem solving. We leave those problems out for the whole entire week. That way, if staff have like an idea as to what might work for us better, they have the opportunity to still post their ideas on the Post-it note, and you can kind of see the little colored Post-it notes kind of represent the ideas for the different staff thoughts that they had. And then from there, at the end of the week, they'll take that problem, and the person who either kind of wrote the problem or the unit champion for that problem will take it forward, create the action plan, and then propose it to the PICU advisory committee. And from there, we'll actually decide whether we're going to implement it or if we need, further discussion about it. And then in May, I actually had the opportunity to go present in Denver at NTI, which is the National Teaching Institute for Critical Care Nurses, and that's our poster board over there that we got to present. It's using the teamwork board by engaging frontline staff in problem solving. And the topic, the information that was provided on the board, and the location of where our board was at was just really engaging, and it brought a lot of traffic. Our board was a lot different from a lot of the other boards that were available to look at for the poster presentation, because it wasn't necessarily about CLABSIs and VABs and how to move an intubated patient, but it was bringing those frontline nursing staff members and using them to solve problems and allowing the management to kind of guide us in how we were going to move forward with it and to have their support in doing so. On the poster board, you probably can't see it in the back, but in there we had some of our employee engagement survey questions that were addressed, and our scores were kind of low in some areas, and ever since we went to the teamwork board process, our numbers have come up, and we've seen a lot of great change in our unit. So thank you guys for allowing us to present here today. Do you have any questions?